Good evening, friends. This is Dr. A Hasan, specialist ENT surgeon attached to Mukta Nursing Home. Today I am going to discuss a topic known as tinnitus. It's a very important topic and a very common problem. Now, coming to tinnitus, what is tinnitus? Tinnitus is basically the perception of sound when no actual external noise is present. While it is commonly known as ringing in the ears, it can manifest as different perceptions including buzzing, hissing, whistling, swooshing, or clicking. There are basically two types of tinnitus. One is subjective tinnitus and the second is objective tinnitus. What is subjective tinnitus? Head or ear noises that are perceivable only to the specific patient. It is not heard by other people. It is usually traceable to auditory and neurological reactions to hearing loss, but can also be caused by an array of other catalysts. More than 99% of all tinnitus reported are of the subjective variety. Then comes the rest 1%, which is the objective tinnitus. In the objective tinnitus, the head or hearing ear noises that are audible, they are audible to other people as well, along with the patient. Now, these sounds are produced by internal functions in the body's circulatory system and somatic systems. But objective tinnitus is very rare, representing less than 1% of the total tinnitus cases. Now we are going to discuss the common causes of tinnitus. In many people, tinnitus is caused by one of the following. Likely, number one is hearing loss. Number two is ear infection or ear canal blockage. Number three is head or neck injuries. And fourth most common cause are the use of some medications. Coming to the hearing loss, why hearing loss contributes to tinnitus, that we'll discuss now. There are tiny delicate hair cells in your inner ear, that is the cochlea, that move when your ear perceives sound waves. This movement triggers electrical signals along the nerve from your ear to the brain. Your brain interprets these signals as sound. If the hairs inside your inner ear are bent or broken, this happens as you age or when you are regularly exposed to loud noises. They can leak random electrical impulses to your brain, causing tinnitus. Now, how the second cause, that is the ear infection, contributes to tinnitus? Now, when your ear canals become blocked with a buildup of fluid, like in some ear infection, or like in otitis media with effusion, or earwax, dirt, or other foreign materials, a blockage can change the pressure in your ear, causing tinnitus. Third most common cause is the head or neck injuries. Head or neck trauma can affect the inner ear hearing nerves or brain function linked to hearing. Such injuries usually cause tinnitus in only 1 year. Fourth most common cause is the use of certain medications, because a number of medications are there which may cause or worsen the tinnitus. Generally, the higher the dose of this medication, the worse tinnitus becomes. Often the unwanted noise disappears when you stop using these offending drugs. Now, the medications which are known to cause tinnitus include NSAIDs, non-steroidal anti-inflammatory drugs, and certain antibiotics, cancer drugs, diuretics, anti-malarial drugs, and antidepressants. Now, how do you manage a patient with tinnitus? The patient is to be investigated thoroughly to rule out organic cause for tinnitus, and if present, treatment should be directed towards the basic cause. The intensity of tinnitus is measured by masking sounds. The intensity of the sound which masks the tinnitus is the intensity of the tinnitus, and as such a tinnitogram can be plotted. Other forms of treatment include the following: masking, hearing aid, biofeedback, and noise generators or tinnitus maskers. Now, how do we prevent this thing in the first place? In many cases, tinnitus is a result of something that can be prevented. However, some precautions can help prevent certain kinds of tinnitus. That is the use of hearing protection. This will prevent a tinnitus which is caused by exposure to loud noises. Like commonly those who are working in factories or in airports where there is exposure to very loud noise, or there is a risk of noise trauma. Turning down the volume, long-term exposure to amplified music with no ear protection or listening to music at very high volume through headphones can cause hearing loss and tinnitus. Taking care of your cardiovascular health, regular exercise, eating right, and taking other steps to keep your blood vessels healthy can help prevent tinnitus linked to obesity and blood vessel disorders. And another way of preventing it is you limit your alcohol, caffeine, and nicotine intake. Kindly consult your nearest ENT doctor for further details. Now, this content is only for educational purpose. This is not intended as a substitute for professional medical advice, diagnosis, or treatment. You must always seek the advice of the physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something which I have told you. Always seek expert medical advice when you're facing the problem yourself. Thank you.